What happened in care and residential homes and was too little done too late. All of this will be examined in any inquiry, but the Prime Minister yesterday appeared to preempt the findings.
We discovered too many care homes didn't really follow the procedures in the way that they could have, but we're learning lessons the whole time.
This has caused outrage among care home owners who have often felt they were fighting the virus on many fronts.
I was extremely annoyed. I was hurt, and I just thought about all of my colleagues who have put their own health on the line to care for people and then seemingly being blamed for doing their job.
Anita Astle is manager at Wren Hall Nursing Home in Nottinghamshire and has spoken to this programme many times over the past months about her frustrations and fears.
The guidance was, for want of a better phrase, rubbish, and many care providers did go against the guidance because they actually implemented procedures that were far in excess of anything that the guidance requested.
It in fact remains unclear what procedures Mr Johnson was referring to, but this is the timeline. Back in late February, as cases began to increase, guidance was issued to care homes saying it remains very unlikely that people receiving care in a care home or the community will become infected. This was not updated until the 13th of March, when new guidance asked no one to visit who had suspected COVID-19 or is generally unwell. 4 days later, the NHS asked trusts to free up hospital beds in advance of an expected surge in coronavirus patients. How many were sent back into care homes and the community without being tested has never been established. But on the 15th of April, testing was finally introduced. By this point, though, nearly 6,000 residents had died. Then came Public Health England's the Easter 6 care home investigation, which found significant numbers were asymptomatic, not showing symptoms but still being infectious. It was not until April the 28th that the results of this were turned into policy, and it was announced that testing would be rolled out to all staff and residents in care homes, whether they had symptoms or not. Throughout this, care homes had to find their own personal protective equipment and pay VAT for it. Many couldn't take new residents for fear of spreading the virus further, causing financial problems. Nearly 22,000 residents in England, Wales and Scotland are thought to have died from COVID-19. But today the Prime Minister was said to have been misunderstood.
Which care homes didn't follow procedures and what these procedures were that apparently were not followed? And will he take this opportunity now to apologise for the Prime Minister's crass remarks?
Throughout this crisis, care homes have done amazing work. And the Prime Minister was explaining that because asymptomatic transmission was not known about, the correct procedures were therefore not known. And we've been constantly learning about this virus from the start and improving procedures all the way through.
Deaths and infection rates are falling in care homes, but it still remains the fact that between March and June, COVID-19 was the leading cause of death for male residents and second most common cause of death for female residents, behind dementia.
Well, Victoria MacDonald, who's been watching this all the way through, joins us now from the newsroom.
Yes, it's not just actually Boris Johnson who has been talking about some care home providers not following the guidelines. In fact, the Scottish Government also said something similar recently. But this has angered many in the industry. They have spent weeks and weeks and weeks watching their residents die, not knowing, sometimes not being able to get help for them, not being able to send them to hospital. They were absolutely bombarded with pages and pages of guidance that they just couldn't get through. And as you heard in my piece, many took it into their own hands to protect their own residents well before the government said that there is a problem in care homes. And that's what's caused consternation. The other problem is that this diverted attention from what the Prime Minister was actually trying to say, which is there is a problem with social care and it does need to be fixed. But unfortunately, that wasn't the headline. And he has said right along that he does care very much about fixing social care. The other thing we've heard tonight from Care England is that there is still no word on when we, all of us, can go and see our relatives in residential care and nursing homes. There's been no word from the government on that. And I know there are many, many people out there who are desperate to go and see their relatives.
Victoria, thanks very much.
Well, joining us now is the Labour MP Liz Kendall, who's the Shadow Minister for Social Care. And as you heard Aisha Tal's report, 5 months and more into this crisis, and some of the most vulnerable people are still unable to get tests. What do you make of that?
I think it's appalling. The government has been far too slow to act to protect elderly people, but we've heard precious little, if anything, about testing and support for adults with learning and physical disabilities and those with autism. In fact, on supported living, the only guidance there's ever been on tests for people in supported living had nothing on testing. It was withdrawn on May the 13th. Nothing has replaced it. I've raised this personally with the Care Minister and written to the Health Secretary about it, because I think that there should be routine and regular testing for staff in care homes, in supported living, and for those who provide home care, because that is the way that we will really keep elderly and disabled people safe.
What did you make of the Prime Minister's remarks last night? I mean, was this a strategy or a blunder?
I think it's about rewriting history and shifting the blame. Care homes and care workers have gone above and beyond the call of duty to try and keep residents safe. 25,000 people were discharged from hospital to care homes without any tests. Care providers saw their PPE requisitioned for the NHS and care workers went without. And government didn't even have a policy for care homes until far too late on into this pandemic. And they've only done one set of tests for care home workers when it needs to be weekly. So for them to try and blame care homes, I think will be appalling. All those care staff, they have seen some truly awful things we can't actually imagine. And for them to hear that for the government, trying to shirk responsibility instead of learning lessons from the mistakes, I think will be very, very hard for care workers and the residents and families of people in care. It'd be very hard for them to hear.
Well, now, what we've learned today is that it would cost £12 billion to get care home funding back to where it was 10 years ago. The truth of the matter is that politicians on all sides have really failed on this. I mean, the truth surely is that when you come together, and apparently you've all agreed you're going to, both sides, Labour and the Conservatives and the Liberals, are going to meet together and debate all this. But what are you going to come up with? I mean, what is the solution? Should the state be running these homes?
You are right, John, that we cannot kick the issue of long-term reform of social care into the long grass any longer. We've had 10 years of cuts to these vital services. We've had a green paper for reform, which has been long promised and not delivered. This has got to be a system that works not just for elderly people in care homes, but for people with disabilities who get care in their own homes. And it's got to be a system that lasts for generations to come. You talk about the costs, and I don't deny that they are very real. But the cost of not doing this, we've seen that impact during this virus. Underfunded services, underpaid and undervalued staff, families who look after loved ones, who provide the bulk of the care in this country, getting precious little support.
But where is all the money going to come from, Liz Kendall?
Well, we will have to pay for care one way or the other. And John, either we leave the costs to individuals who could see all of their savings wiped out, or we pool our resources and we share our risks. And I would also say to you that for many families who are also trying to care for an elderly relative and hold down their work, they often have to give up their work because they can't get the support they need. That's not good for them, their incomes, or for businesses in the country as a whole. And if we don't get a good system of care, It ends up putting pressure onto the NHS, which is more expensive. We can't afford not to make changes here. And I really hope that the one thing that comes out of this awful pandemic is that we seize this moment. The challenge of reforming social care is our generation's challenge. And I, for one, can say that Labour is determined to meet it.
Thank you for joining us. Thank you. Well, we did, of course, ask for a minister from the Department of Health to come on the programme. No one was available.